Yeah. So let's begin with our next speaker. We have the next talk divided into three sections, um, which will be presented by three different speakers, and we are privileged to have all three of them. We begin with Miss Sanjeeda Arora. She's a public health researcher with a postgraduate degree in social um, epidemic epidemiology from Tata Institute of Social Science, Mumbai. And she has a graduate degree in dentistry. Like I said, we have a very versatile speakers today, and we're privileged to have everyone's opinion on our topic today for suicide prevention from every arenas. She's currently working as a research officer with the Center for Inquiry in Health and Alien Themes, which is a Mumbai-based research organization. So please welcome Ms. Sanjeeda Arora.
Thank you for giving this opportunity. As the session is about the health system's response, what I'm going to do is to present the evidence on the relationship between domestic violence and suicide attempt, and what health system can do to respond to the suicide attempt in the context of domestic violence. Okay, fine. Yeah. So just to give a background that Sehat established Dilaasa, which is a public hospital-based crisis center way back in year 2000. And the rationale for establishing Dilaasa was that the violence against women is a public health issue. Domestic violence has serious physical, mental, and social health consequences for the women. And the Lhasa department operates as the department of the public hospital as well. So if you see its presence, it function as it is within the gynec OPD, and it function as one of the department of the hospital, and it has the number as 101. So the women who are identified by the doctors, they are sent to the Dilaasa department, just like the referrals to the any other department of the hospital. I spoke about presenting the evidence about the relationship between suicide attempt and domestic violence, and what the health system can play a role. So this evidence is based on the analysis of the counseling case records of the women who accessed these crisis intervention services from the year 2000 to 2010. And what we found that there were around 2,148 women who came to this crisis center in these 10 years. And out of these women, the suicidal ideation was found in 25% of the women, and the attempted suicide was found in 15% of the women. So now this attempted suicide part, I just want to brief you about this. So 15%, which was about 285 women, these women were admitted in the hospital with the complaint of accidental consumption of poison, right? And then they were not identified as the cases of the attempted suicide. It was only the counselors of the Dilaasa which they go for the ward round and speak to the women, and they ask about the domestic violence. Otherwise, within the health system, there is no such mechanism to inquire about such cases which they get admitted in the hospital with the complaint of accidental consumption of poison. And so the further analysis, what we did was to identify the factors, to identify the socio-demographic factors of the women who had suicidal ideation and who had suicide attempt, just to see the difference. So, so majority of the factors are same. What we found is that the women who had suicidal ideation and attempted suicide, they are the young women within the age group of 18 to 25. They are married for 2 to 3 years, and they were facing emotional abuse much more as compared to the physical violence. So the fact that the physical violence, which the emotional abuse, which often go unaddressed and is not given much emphasis, so we need to be careful to see that the emotional violence also has serious health consequences, right? And then the other thing that we found that the various reasons were cited by the women during the counseling, that what were the reasons for attempted suicide. And a large proportion of the women were unmarried, and for them the disapproval of the relationship with the boyfriend or the partner from the parents was one of the reasons for attempting suicide. And then for the few married women, the suspicion by the husband was also one of the reason. And then in violence from the husband in form of extramarital affair, and then asking for divorce or separation uh, were the reasons cited by the women for taking this step. The feeling of hopelessness about their future, about being labeled as a separated women, appeared to be one of the major factor for the women to attempt suicide. And so the qualitative analysis that we did, it indicated that the feelings of rejection, hopelessness to cope with the situation among women facing violence forced them, to take this decision. And when we speak about the health system, there was no mechanism within the health system to respond to the psychosocial needs of these women. The Dilaasa was there, the counselor spoke to the women, and then the counseling services were provided. But the Dilaasa center is not available in all the hospitals. So there is a need to understand that the health system plays a critical role in responding to such cases which gets admitted with the complaint of accidental consumption of violence. The healthcare providers, they very often have the idea that they know that this is not the actual reason that woman is giving, that she just drank the bottle of poison by mistake, thinking that it's a cold drink bottle. They know, but they don't want to get into it. They see it as a medico legal case, that's only, and the domestic violence as a private subject, and they don't want to get into it. But they are in a key situation, to identify these things, and to respond to them so as to meet the psychosocial needs of the women. The other thing is the fact that the organizations which work on the interventions to address the domestic violence, they also need to focus on the psychosocial consequences of the domestic violence. So we need to have the safety assessment, safety plan of the women who face violence, because it's not about only about physical safety, the prevention from abuse, but also about the suicide ideation and suicide attempt. And then the other thing is that the health systems, they are in a very strategic position to do this, because a woman facing violence may not go to the police station, but she will come to the hospital, and the hospital offers a safe space to her, because there is no stigma attached to it. Even the abuser will not come to know that she is walking into she is going to the hospital to get crisis intervention services. And the other thing is that the interface of the young married women with the hospital comes at various stages, like during pregnancy, for the immunization of the child. So the crisis intervention services based in a hospital can lead to the early identification of women facing violence, and can prevent such mental health consequences like suicide attempt and suicide ideation. Thank you.
Yeah, thank you, Ms. Sanjeeda. Um, even Ms. Suchitra mentioned before lunchtime, a lot of percent of women do go through the mental health pressure, and again, stemming from the ideation to the actual act. These sort of finding can help us understand the leap and what can be done between in the action between.